Hi, my name is Christy Lessnau. I'm the Senior Nurse Manager of the West Valley of Ironwood Cancer and Research Center. I'm here to discuss ports with you. A lot of patients have many questions on why and how ports are used, so we will go over that in this session. What is a port? A port is an easy access for nurses to administer chemo safely and effectively. We don't want to always start an IV on your arm because it can be dangerous with certain types of chemotherapy if it infiltrates, which means it could go underneath the skin and cause problems. So it's very important to discuss with your doctor whether or not you do need a port, as well as your nurses. You may need a port for certain types of chemotherapy, again, because some are more harder than others and can affect the skin in a way that could eat away the skin and cause necrosis. So it's very important that you discuss with your physician if this is the type of chemotherapy you're getting. In addition, a lot of patients get dehydrated and it can be hard to get an IV on them. If you're a tough stick or you get dehydrated, it's very easy to access the port and we can give you the hydration and stick you one time instead of 5 or 6 times. The port is better for chemo, again, because it's administered safely. It allows us to make sure that we are giving the chemotherapy intravenously and it's not going sub-Q underneath the skin. What is the surgery like? The surgery is an outpatient procedure. The normal time frame is about 45 minutes to an hour. It's a twilight type of anesthesia. And what they do is they kind of just put you a little bit out of it. You're not completely under. And it goes through interventional radiology. And the physician will make small incisions, 2 small incisions, and put the port underneath the skin, and then surgically stitching the tube or catheter into either your jugular vein or your subclavian vein, which allows the medication to go straight to the heart. How long does it take to heal? Usually it takes about 7 to 14 days to really get that healing process. The physicians will put glue on the outside sometimes, so you need to wait again for 7 to 10 days before you start peeling that off so that you allow the stitches and the incisions to heal. You will see 2 incisions, one on your neck and one on your upper chest. Those are where they inserted the port and was stitched the catheter into the vein. Can I shower and bathe with a port? So again, you can get it wet minimally, but you cannot shower, bathe, or go in the pool with the port for 7 to 10 days. You want to keep it dry as possible for that first 7 to 10 days to allow healing. How do I take care of my port? As a patient, you really don't need to do anything. The nurses will be the ones that take care of the port. They will flush it if needed. They will make sure that it's not infected. They will assess it and take care of everything regarding the port. You do not need to do anything as far as taking care of your own port. Is there any issues sleeping with my port? No. You can sleep on your side. You can sleep on the side of the port. You can sleep on your back or your stomach. There's no issues. Sometimes, in rare cases, just moving around or playing with your grandkids or your own kids, the port can flip over. And this can cause an issue to where we can't access it. It's very rare, but the nurses will be able to tell if this does happen, and we can assess the port to see if this is something that we need to refer you back to your physician. What's a port flush and how often do I get one? A port flush is something that we have to do every 4 to 6 weeks. Sometimes you can go a little longer, but you don't want to go longer than about 3 months, because sometimes what happens is the port can get a clot in it, or it could not allow us to flush it. So you want to keep that flow going. And so what we do is we administer 20 mLs of saline and we flush it just to make sure that it's going through and that we get blood return, so that we know that the port has not moved out of the vein and that it's still easy to access. Another question that people ask is, when do I get the port removed? This is something that you discuss with your doctor. It depends on how long your treatment is and if you have to continue to treatment in a later time. So again, ask your physician if you can get your port removed after chemo, or if you should wait 6 months to a year just to make sure all scans are stable and you don't have to get the surgery again. Any additional questions, please feel free to ask your nurses or your physicians. We're always here to help. I'm going to demonstrate how we would access. So sometimes patients feel a little poke. If that poke is too much, we can prescribe you lidocaine cream, and then you put that on 1 hour prior and then come to the clinic and you wouldn't even feel the poke. The poke is not really that bad. It's just like inserting an IV needle, but some people are a little bit more sensitive. So first, we would clean this area for about 60 seconds and allow it to dry. Infection is huge and can be very dangerous if we don't clean it properly, or the nurse, some nurse that does not know what they're doing, accesses this. The second part is the needle. And this is the needle that goes into the port. And it's just really easy, one poke, done. And that's how simple it is to use a port. And we don't have to continue to try to access you, especially if you have difficult veins or you're dehydrated. We can give you those fluids very easily. And then the medication gets connected to this access point. So as you can see, the port is a very good option for chemo patients. It's safer, more effective, and it's less painful for patients that have to be sick multiple times. Port is very easy maintenance. A lot of patients love it once they get it. It is time consuming just to go and schedule the appointment to get it implanted, but once you do it, you'll never regret it. It's so much easier for you and your nurses to access you when you're getting chemotherapy, and it's a lot safer. Again, if you have any questions on ports, please ask your nurses or your physicians, and they can go over any other questions that you may have. Thank you for watching this video.